when I saw the data on Alzheimer's and Parkinson's. So those are diseases that affected me personally. My mother had both conditions simultaneously, and it was a very difficult time in our lives.
Welcome to the Sinclair podcast, where we share real-world experiences, wisdom, and the honest struggles of entrepreneurs to help you navigate and scale your business with confidence.
Victoria, thank you so much for coming down. You made the trip from Toronto to Little St. Catharines,
all the way
to
here.
Our little humble studio. So
Thanks for having me.
I truly appreciate it. It's such a pleasure meeting you recently, I'll say.
Yeah.
With your support and work with Stoke Bio and through helping Jeff, our CEO, through the Creative Destructive Lab. Thank you so much.
Oh, you're welcome. It's been a pleasure, and it's been a lot of fun for me too.
Love it.
Yeah.
When did you first realize you were all in healthcare and science, I'll say?
Oh, wow. I guess, it started really young. I don't know if I was necessarily, I knew I wanted to be in healthcare in some shape or form. So I knew I wanted to make an impact on patients' lives, and I was really drawn to that, and I love science, and I did well at science. And I think the funny thing is I ended up in the pharmaceutical industry, and now I'm more on the biotech side. But I don't think anybody kind of grows up dreaming about being a pharma rep. It wasn't even in my vocabulary at that time. So it was a bit of a journey in that I initially wanted to be a doctor, probably because my parents wanted me to be a doctor, but regardless. And I took summer jobs where I was working in the hospital. One of those jobs I was karyotyping. Do you know what karyotyping is?
No, what is that?
Yeah, so believe it or not, and I don't know if they still do it this way, but a lot of diseases, especially some cancers, are detected through your chromosomes. And so I studied genetics, and so I got this really cool summer job where I would take photographs. So I would lyse people's cells, right? We'd get a sample, and we would bust open the cells, and then we would take photographs of the chromosomes. And then I would literally cut them out.
How old are you doing this work?
I was I think I was in college. I was probably in my 20s, 22 or something like that. I was working for a lab. It was a summer job.
Oh, that's cool.
And I would then, cut out all the chromosomes and I would paste them. I would glue them on a piece of paper, and there's 46 chromosomes. And then if there was any material that was left over, then that was usually not a good sign. And so one day, the professor that ran that lab asked me, could you run over to sick kids? And there's someone a child getting a spinal tap there. You need to collect the sample and bring it over. And it was a 16-year-old boy, and he's wearing a baseball cap, and it was summer, and he had, he was glowy and tanned, and he looked so healthy and sparkly eyes. And when I connected with his eyes, I felt so sick inside because I had seen this kid's genetics, and I knew it wasn't good, and I actually passed out in front of them. So,
oh my
here the
gosh,
kid
no
is
way.
so brave, and the doctor's doing the tap, and everyone's how's your summer going? And then, of course, you have this person, can we get you some water? And they're fanning me. So, I think I knew at that point, and I had many experiences like that after, that I loved connecting with people, and it was something I was really good at, but I wasn't equipped to deal with the enormous burden of caring for people that are ill. And so I segued into the sciences, and I went to graduate school. I did first year med school where, again, I had those kinds of encounters. I knew in my heart that it probably wasn't for me. And then the opposite was true working in a lab where I wasn't connecting with people, and I didn't feel that I would be making an immediate impact on people's lives because the road to discovery is so long.
Yeah.
And so I took a break. I thought I was going to go back to school, and I thought, I'm just going to try working for a pharma company for a while. And to my surprise, it checked all of my boxes. So I was able to really work with the medical community and bring products to market that changed people's lives in a really meaningful way. So that's kind of how I got into it.
It's really interesting because in a lot of ways you learned two things that you didn't want to do.
Yeah, that's true.
That got you to the path.
Yeah.
Tell me about your first couple experiences in pharma.
Well, interestingly, I think my very first experience, I was working as a sales rep, and I was carrying diabetes products, cardiovascular, and diet pills, which back then were not as popular, actually. And I actually thought I wasn't going to continue. So I thought,
Why?
because it wasn't for me, in the sense that back then the pharmaceutical industry was very, very different, and there was a lot of entertaining, a lot of golfing with doctors, and it didn't feel right for me at that time. It was a lot of fun for a couple of years, I guess. And I actually thought I was going to leave the industry and go back and do something else. But then I was getting my car serviced, believe it or not, and a woman walked in with an Eli Lilly T-shirt, and I struck up a conversation. And she ended up being like one of my mentors throughout my entire career, actually. But we started a conversation. She asked, what's your background? And I said, well, I did cancer research, and I have a little bit of sales. And she's like, great, send me your resume. And so she, at the time, was responsible for launching cancer drugs at Eli Lilly. And that really changed the trajectory of my career, because I think working in cancer is really different. You're talking about patients, that are dying. It's a very serious business, and working in that business really gave me the opportunity to work more closely with physicians, and I felt like I was making an impact, and I met some of the patients who are on our therapy as well, and got to put a face to it. So it became really meaningful for me at that point.
That's incredible. All from meeting in a service station.
Totally.
Getting your car fixed.
Who knows where I'd be today if that didn't happen.
Isn't life wonderful that way?
Yeah.
What were some of the moments in your career that felt most natural for you as you sort of made the evolution through different areas of pharma and biotech?
Yeah, I mean, it always came down to solving complex problems for me. Like I love working with teams. I loved launching new products. Was always fun. But I think working in teams and solving problems. I think one of the biggest misconceptions in the industry is that we just make these products and then we just sell them to doctors. But there's so much more to it in terms of getting the products into the patient's hands. And I really enjoy that process a lot.
How much has sort of, let's say, the internet, ChatGPT, OpenAI, how much has that changed and challenged the pharmaceutical industry over the last, say, 10 years?
Oh, wow. Well, I think the internet, for sure, and I'm probably guilty of it as well. I'm sure you are.
We all are, yeah.
Patients are much more empowered. They're showing up at their doctor's office with their Google research. And I think it's really challenged physicians to manage that, because there's a lot of really great information that you can get from the internet, but there's also incorrect and misleading information, sometimes even dangerous. So I think the pharma industry's had to contend with that, but I think it affects the physicians the most, because they're the ones that are caring for these patients, and they need to make sure that they get the right therapies. And now there's just so much content that you can get. You can actually go into chat and you can research your disease. I think that also presents a lot of opportunity in the future. There's a lot of companies now looking at, how can we collect data and use that data to predict what drug you should be on. So I think what we're seeing right now is an acceleration of drug discovery because of those advancements. So I think at the end of the day, it's going to benefit society as a whole, but I think there's a bit of a learning curve for us to figure out how to best use it so that patients get the best care.
Hey everyone, I got a huge favor to ask. If you're getting value from this podcast, tap that 5-star rating on Spotify or Apple. The more we grow, the more leaders and entrepreneurs we can help. Thank you for being a part of this. Now let's get started.
What are some innovations or just things in biotech that you're super excited about right now?
Stoke Bio.
I love it. What a shameless plug.
Absolutely. I think
sort of on a broad term, maybe.
I'm personally excited to see a lot more innovation happening in areas where there was a lot of failure. So, for example, I'm seeing a lot of activity occurring in neurology, right? So Parkinson's, Alzheimer's, those areas have been very tough in terms of advancing, and I think we're seeing a lot of exciting activity there. in oncology, I think immunotherapies are still kind of the bread and butter. They have really changed the trajectory of survival for patients with a number of different cancers, but unfortunately not every patient responds. I'm really excited to see the kind of next generation of immunotherapies and products that can improve the outcome so that more patients can benefit from those immunotherapies. I think that's kind of exciting. I think AI in the right setting can also be very exciting in that there's a prediction that AI is going to be really accelerating drug development timelines by being able to, screen a lot more molecules, a lot more targets, and so forth. And so I think it's kind of an exciting time to see these sort of different developments happening and seeing AI applied, particularly in the setting like Stoke Bio, where they're combining AI with a wet lab. So I think that's really interesting.
And the whole concept, if we can cut down the time, lower the cost, then that's only going to benefit the end user getting these drugs.
Yeah, absolutely. And it's also giving rise to like new discoveries, right? There's new ways of approaching drug discovery through AI, which was never possible before.
Yeah, it's exciting.
Yeah, for sure.
Okay, I want to switch gears. I dug for this fact, but women still hold only 24% of biotech executive roles.
Yeah.
The pay gap is still sitting around 20%. And we're in 2025. Why are we here?
That's a really good question. So first of all, I want to say that things have really, really shifted, especially in the pharmaceutical industry. So over the last, I would say, like maybe 5 to 10 years, I'm seeing more executive committees are expanding locally, right? So each pharmaceutical company has like a local affiliate. And, for the most part, back when I was younger, a lot of those, what we call line positions, CEO, finance, executives responsible for commercializing, they were largely held by men. And I've noticed through LinkedIn, but also just, I'm sure if you looked at the data, that women are now holding more and more of those positions. I've seen a lot more female CEOs, heading up companies like Sanofi locally and AstraZeneca. And so I think that never happened in the past. At least when I was growing up in pharma, it was always male. So we are seeing a shift. But that being said, I think when you go and you look globally, so you look at the C-suite of a pharma company that's headquartered in Switzerland or headquartered in New York, for the most part, the CEOs are all white male. And so we haven't seen, and the numbers speak to it as well. So we haven't seen, certainly we're seeing a groundswell of women moving up into those positions. We're seeing more women on the executive committee. But I think in those line positions, the numbers are still not progressing in the way that I think we were hoping to. There are exceptions. I think smaller companies like Regeneron, I think, or Alexion, I believe, have 40% of their executive committee or more are female. And so that's inspiring to me. So why is that happening? And I have my own theories. I'm sure everyone does. I think it's a combination of networking. I think there are networking groups locally for sure that are helping women. But historically, women haven't participated in networking and creating that kind of advocacy like men have.
Yeah, I was just going to use that word, advocating.
Like when I was younger, and this still happens to this day. There's companies that I used to work for that got bought and sold, but the men still get together once a year and they go on a golf trip together, right? And that's pretty common. I can think of like 2 or 3 groups like that, but I don't know of a single group of women that go golfing together, And
sounds like you got to start one. Do you golf?
Yeah, very poorly. But my point is that I'm not saying they shouldn't have. I think it's a great thing. I think men should go and have those relationships and continue to. So I'm not by any means suggesting that shouldn't happen. But I think the challenge is when you're in those sort of organic situations where you're on a golf course and and you have a very senior person and a younger person, and they're probably talking about business at some point, and so those younger men get information that can potentially help them in their career at some point, or they're building stronger, more organic relationships versus the networking opportunities that I see for women there are some really great groups that are out there now, but they tend to be like kind of more educational, like you go to an event and there's a really great speaker. And so I think that's part of it. I think the second part is the unconscious bias. I think it's huge. And I've read about this, I've seen it, I've experienced it. And so let me give you an example of what I mean by the unconscious bias. And we saw it in the US election twice. So we had a female candidate and we have a male candidate. And I'm not trying to get political, I don't think the party matters. But if you look at a woman who has to be successful in business, she has to be very results oriented, very tough. She's got to make the tough decisions. She can't look weak. And if she does that too much, right, then they'll say, well, she's too tough. You look at Hillary Clinton, for example, and they said, oh, she's not nurturing enough. She didn't care about her children. And there were these kinds of comments made. So then if you try to be nurturing, then they'll say, well, she's too nurturing. She's too empathetic. She's never going to be able to stand up to Putin or, one of these dictators if she's too soft. Yeah. Now let's compare that to Trump and Biden. You have Trump. He's the strong man. He's the tough guy. He's not trying to be a softie, right? There's no need for him to be both, right? Versus Biden was the empathetic leader. He was softer, more approachable, more caring, but no one questioned whether or not he could stand up to an authoritative leader. So I think the problem is that women have to be both. There's these stereotypes that if you're too tough, you're not nurturing. If you're too nurturing, you can't make the tough decisions. And
you're set up for failure. Like
it's
almost impossible to succeed through that.
Right? And men never have to achieve that balance. But some of the most successful women I've seen in business are extremely charismatic. They're very results oriented. But then, they make a point of being empathetic, right? So, and I feel like that's something that I've really strived for in my career too, is to be results oriented, but then also to be a supportive leader. And I think in that's the best kind of leader, to be honest, right? If you can embody that. But
males are also being, I think, more celebrated. It's like, oh wow, they're empathetic and vulnerable. That's great. That's now this all of a sudden wonderful quality, which it should be in anyone.
Yeah, exactly. Yeah, so I think that's a challenge. At the senior levels, and by that I mean like the CEO of a company, right? And I think that's partly why we don't see as many women in those positions, because it's kind of impossible to achieve, really.
Were there moments in your career where you felt those gaps and some of those challenges?
Yeah, absolutely, and not just in my career, but I've seen them in other people's careers, right? I've managed really talented women who I think eventually they've all gotten there, which is really, really great. And that's super gratifying for me. But if I look back when I was working with them, and even myself, there's a lot of sidestepping, so more hoops to jump through.
Yeah.
Just launch this product, and then we're going to give you this promotion. Or just, do this job over here, and then you can be a director. And I think that's changing because like I said, I'm seeing more and more women getting these really, really great roles and kicking ass.
Awesome.
But I do remember a time, if I'm looking back, where many of them, had to do additional roles, right, before they would give them that big break. Versus I've seen men with the exact same experience kind of move a lot faster into some of those more senior positions. So I think
moved in the right direction, but still, I think more advocacy needed and conversations around it.
Yeah, and I think there are really great programs for women. In most pharma companies have excellent programs where they're really trying to nurture the talent, and we are seeing those programs at work, and they are working, right? But I think the unconscious bias piece, it's kind of difficult to unravel something that's really culturally ingrained. It's going to take time, and I think the younger generations that are coming up have grown up in a different world, right? Where their parents were working, maybe they had moms that were senior leaders. So I'm excited to see the future, and I think we're going to see more women taking on these big jobs for sure.
Love it.
Yeah.
Circadian health. What is
Yeah.
it? Tell us more. This is, I know, something you're passionate about and you're very involved in now.
Yeah. So let's talk about circadian rhythms first of all. Like, what are they? Like, what do you know about circadian rhythms?
It's the thing that tells me, when I need to wake up, when I need to go to bed. So I feel like when I put my kid down at like 7:38 and I fall asleep every time my wife does, I'm like, that's probably my body telling me something. I'm relaxing, I'm slowing down.
Yeah, or sometimes you just wake up automatically, even though
I don't set an alarm anymore. I think kids do that too, but no alarm needed for the most part. But that's really the most of it I know. It has to do with sunlight.
Yeah. Yeah, so that's a lot, actually. That's a really good start. So your circadian rhythms are present in every single cell in your body. So a lot of people think circadian rhythms only come from the brain, but like every layer of skin, every cell in your body has a circadian rhythm, and even your microbiome in your gut are beating to the circadian rhythm of your host. And what circadian rhythms do, they're not just for sleep, but they affect every aspect of your life. They affect your appetite, your mental health, your cognitive abilities, your energy, aging, your alertness. So anything that you can think of, your hormones, female cycles, these are all guided by circadian rhythms. And the circadian rhythms are like these 24-hour cycles. So the best example is, we'll use skin as an example.
Okay.
So you have circadian rhythms in your skin cells. So when you get up in the morning, your skin and its activities change, right? It goes into protecting you against UV light, believe it or not, right? The pH of your skin changes, the hydration of your skin changes. And how does that happen? But it's these little, I'll call them messengers. And these are the genes, which are your clock genes, that guide your circadian rhythms, right? So these little messengers basically tell you to wake up. They tell you your skin automatically to go into defensive mode. And then at night, the activities that occur are going to be like repair and DNA repair, let's say. And so the cell turnover happens in your skin at night. That's why a lot of companies like Estee Lauder and other companies have these really amazing night creams, because they realized through their research that circadian rhythms at night are very different than during the day. So, during the day you want to hydrate and you want to take advantage of those circadian rhythms, but at night it's going to be more repair and turnover. And this is all guided by your circadian rhythms. And it turns out that these rhythms, which literally look like musical rhythms, when you're young, they're really bouncy, right? They have really high peaks, and then they flatten, and then there's a high peak again. And as you age, or it could also be environmental factors like shift workers have disrupted rhythms, or if you're spending too much time looking at your screen, that's going to disrupt your rhythms. Or during COVID, we saw a lot of people weren't leaving their house, and so they weren't getting that sunlight.
Sure.
And we saw more mental health issues during COVID because of that. So I think your rhythms can get disrupted, and they go flat. So rhythms are really, really essential to your health, and that's why groups like the Global Wellness Summit had declared that in the next 5 years, circadian health would be the most important target for wellness, and that it wouldn't just be for your sleep, but it would be for your longevity, right? To prevent weight gain, to have cardiovascular health, et cetera. So they are so vital, and yet there's really not much beyond light therapy today that can be used to improve your circadian health until now.
Okay, so what got you in? This is fascinating.
Yeah.
I think we need to show some graphs, and I have so many questions.
I'll send you some
Okay,
materials.
we can add some material in, but do these sort of up and down cycles look similar every 24 hours?
Yeah.
Okay, so there's some patterns to them. And how long does it take to screw these up and disrupt them?
I think it depends on the person, actually. But we know through genetic studies and epidemiological studies that when your circadian rhythms are disrupted, your health becomes disrupted, right? So if I knock out the genes of a mouse, for example, and I take the core gene BMAL, is one of the clock genes, and I mutate it, that mouse is going to have accelerated aging. So aging and circadian rhythms have a very strong association.
These affected by stress as well?
I would think so. But I think it's lifestyle. Yeah, lifestyle, lack of sleep, lack of sunlight. And I think now our company is developing interventions that can change that.
So tell me about the company. How did you get involved, and what stage are you at?
Yeah, so I got involved pre-COVID, and I was introduced through an acquaintance. And he said, "Oh, you got to meet a friend of mine. He's got this amazing product, and he could really use your help." And so that's how I got involved with it.
Sorry, at that point, did you have any interest in this area?
Well, I had an interest in health and wellness.
Okay.
Right? So I had already
check that box for you.
Yeah, I'd left pharma at that point, and I had actually done a startup that was more in, let's say, in the plant sciences realm.
Okay.
And so less pharma, more consumer driven. And so I was already sort of starting on that path. And I think what attracted me to circadian health initially was when I saw the data on Alzheimer's and Parkinson's. So those are diseases that affected me personally. My mother had both conditions simultaneously.
Oh, no.
And it was a very difficult time in our lives to watch somebody so vibrant and so full of life and so smart, basically affected by these terrible conditions. And so when I saw the data that even in humans, that these actives could reverse and prevent conditions like Alzheimer's, for example, so memory impairment, that's when I got really excited, because there were literally hundreds of studies looking at this compound. And this is even before I knew that it regulated circadian rhythms, actually. Initially I was just looking at this compound, and I thought to myself, how come no one in pharma has developed this thing? This compound's amazing. It's slowing down the growth of colorectal cancer in mice that were induced with colorectal cancer. It was improving mental health in mice that had depression and anxiety. It was reducing inflammation. And it almost seemed like, pharma doesn't like products like that because they like clean targets, right?
Sure.
It's I want to know that this drug is hitting this target. And this wasn't that. This is a product that has multiple benefits, and I couldn't explain it, but I was really fascinated by it.
And this is a natural product,
It's a natural
found
product,
in nature,
right? Yeah,
from a plant.
So then a study came out a few years ago where a group of scientists in the U.S. were very interested in circadian rhythms, and they were screening products for circadian rhythm activity. So this is very unique. We're not talking about melatonin, which resets your circadian phase. We're talking about actually increasing the rhythm itself, right?
More of those.
That hoop that we talked about, the peak. And so they created a system, which was a cell system, which produced flat rhythms. And they screened over 250,000 molecules, synthetic, natural, flavonoids, you name it. They were screening these molecules, looking for circadian rhythm activity. And that's when they found these two molecules, which were bioflavonoids, and they're extremely rare. They come from a very rare green mandarin that can only be grown under certain conditions. So it's like sourcing this product is very difficult too, because an orange doesn't yield very much of this compound, even though you can find this compound in a number of citrus fruits, but this one particular mandarin can produce this compound. And we later found out that this molecule actually binds to a protein which modulates the clock gene BMAL, which I mentioned earlier, which when you knock out BMAL, it causes a flat rhythm and it accelerates aging. So we know this molecule in cell systems and in animals enhances circadian rhythms. There have been a number of animal studies showing that, if you take obese mice, for example, and you feed them this product, they'll lose like 40% of their body weight.
Come on.
Right? And yeah, absolutely. And it'll improve a number of other markers. The mice, live longer. They're more physically active, I guess you could say. Maybe running more. I'm
They're
not sure how
just
they
loving
measure
life
that,
more, yeah.
Yeah, so there's a number of markers that they discovered that are really important markers to longevity that were enhanced as a result of receiving this molecule. But when they knock out the mice, their clock genes, all of a sudden the product wasn't working. So we know that this product works through the clock genes. And the reason, now I can explain what I couldn't explain earlier, which really excites me because I'm a science geek. But the reason why this molecule had such a ubiquitous effect in that it was having such a positive effect on so many different markers is because it was doing it through circadian rhythms.
That's fascinating.
Yeah,
what an exciting
circadian
opportunity.
rhythms themselves have a ubiquitous effect because they're in every cell. And so that's how this molecule works.
So why can't a molecule like this be synthesized and not just derived from the natural plant?
Yeah, a couple of reasons. One, the molecule that we've discovered is a derivative. And the molecule itself, like many flavonoids, like turmeric, curcumin, these are all flavonoids that we know have anti-inflammatory positive anti-inflammatory effects, but they don't have very great bioavailability. And this molecule
and explain
also,
that.
What it means is, an example of this molecule, if you were to take the molecule and extract it, put it into a pill, it wouldn't absorb into your gut. It would basically pass through you. Actually, Nobiletin has slightly better bioavailability compared to the other flavonoids that I mentioned. It's actually not as bad, but still it doesn't hang around long enough to absorb into the gut. And it's actually, the compound itself is a crystal. So when you put it on your skin, for example, we're doing a topical for an anti-aging and anti-inflammatory product. And so when you put it on your skin, it just sits on the surface. It might get into the stratum, which is the top layer, but it really doesn't absorb into the many layers of your skin, and therefore it doesn't have the effects. And what we did is we took one of these derivatives, and we use kind of the way I'll describe it. It's not exactly the same, but the way I'll describe it is this very similar technology to aspirin, which is called the prodrug technology, where we essentially attach another natural compound, in this case it's a fatty acid, and we attach it to the molecule, and what that does is essentially protects it and allows it to absorb into your skin or into your gut. And then once it gets there, we have enzymes in our body that basically snip the molecule, and now it just becomes the natural compound again.
That's fascinating.
Yeah, it's exciting. The girth of data. I don't think I've ever launched a product in my career that had this much preclinical data on the natural substance. It's incredible.
Because it's just been around so long and explored so many times.
Yeah. So my vision is I'd love this to be used like vitamin C. Like it can be put into beverages. I could totally see that. And so I think for longevity, especially in countries where the medical system perhaps isn't as robust as it is in a country like Canada, and you have a lot of disease and a lot of challenges, I think a product like this could really make a huge difference. I also think that we have, in the very near horizon, I think they're predicting, like in the next 5 years or something like that, that 1 in every 5 person will be over 60 years old. So the burden on the medical system that is about to
we have no idea
approach us is going to be massive, and we're talking billions of dollars, and not just managing the health of these patients. I'm not just thinking about like nursing homes and things like that, but I just think just like the pure number of people that will be in that age bracket versus the number of young people that will be working and supporting this age bracket it's going to be a problem.
It's
major
frightening.
problem.
I mean, even just on a local level, like knowing the capacity and how close we always are to not having enough beds, enough doctors, local referrals. I don't think people realize how frightening that is. And to your point,
They don't.
that many more people at ages where they're more susceptible to disease, sickness. It's frightening.
Yeah, so think about who was most affected by COVID.
Yeah.
It was elderly patients.
Yeah.
Right? Because their bodies, and I also think it was because of their circadian rhythms. So there are studies that have been done in skin, for example, where they treated skin cells that had been infected with viruses with our product, and they were more resilient. And that was simply because of increasing circadian rhythms. So I feel like it's going to play a really huge role in increasing not just lifespans, because people want to live longer. But I think most people, especially if you've had sickness in your family and you've seen what that could look like, I think most people don't want to live incapacitated. Sure, I want to live to be 150, but only if I have all my faculties and my energy and I can go golfing.
Quality of life and live longer.
Yeah,
right?
it's everything. So I think the concern right now is that people are living longer, but with poor health, right? So they're going to require a lot more services from healthcare. And if our molecule can change that, that would be, that's our goal really, is to show that this molecule can have an overall impact on society, on health spans.
It's incredible. I'm so excited
Me
to
too.
watch the next couple of years and as things unfold and evolve for your company. So
Yeah, thank
really
you.
exciting.
I'll keep you posted.
Yeah,
for sure.
it's awesome.
I'll be back.
Let's talk about a new founder, a new CEO. What advice do you give to them when you're coaching? Because you mentioned earlier you do a lot of mentorship and you're involved in helping other startups. What's one or two pieces of advice that you share along the way?
So let me start with, I think for founders, it's recognizing what you're really good at.
Yeah.
I think that's the most important. And I think Stoke Bio has done a really, really great job of that, because what happens is, for a small startup company, and I remember reading about this before I started working with startup companies, and I thought it was like very obvious, let's just say. So I'm about to say something very obvious, but let me explain why I think it's important. But I remember reading about a venture capital company who was being interviewed, probably in a podcast like this or in a newspaper article, but I've seen it a few times. And they said, what do you look for when you're investing into a startup company? And the number one answer is, I look at the management team. I just heard it last week, actually. I was talking to an investor about Stoke Bio, actually, and he said, I want to meet the management team. So, and then I thought to myself, why is that? Like when I was younger, why do they need to meet management? I mean, what if they have the cure to cancer? What does the management team have to do with it? Well, the answer is everything.
Yeah.
Everything. You can have the most incredible technology known to mankind, but if you don't have the right people leading the company, it will never see the light of day.
It's great advice.
It's
and so true. Simple but true and need to be shared as a reminder.
I feel like I hear it a lot, and yet until you experience it firsthand and know what that looks like. So what can founders do about that? And I think one thing they can do is surround themselves with the right people. A lot of founders are brilliant scientists. You don't want to come between them and their test tube. Like they have that
great.
brain that I could never compete with. But they have to recognize that maybe fronting a company might not be their jam. Fronting a company requires operational expertise, communication skills. It's just a different competencies that are needed to successfully sell your ideas to investors. I think you need people that have manufacturing expertise, regulatory expertise. So I've seen situations where founders are not. They want to be in charge of their destiny, which I get, but they don't always trust their advisors, and that can make for a longer timeline. Because, eventually it's like trial and error, and I think they get there. But I think, of course, it's important to question the people around you, and you should always question no matter what. But I think make sure that you are very careful in selecting really great people. Surround yourselves with fantastic people, and don't be afraid to delegate, because you can't do it all yourself. And it's really important to utilize, even if they give you bad advice and you make mistakes, you're still going to move faster than trying to do it all yourself.
For sure. And to your point of not taking them so far away from the thing that they do probably better than anyone else.
Yeah.
And that they probably like doing the most too.
Yeah.
Awesome advice. I love it. Let's talk about you. What's a habit on the daily you can't live without?
On the daily, a habit is drinking coffee.
I agree. It's a must.
I can't.
Are you a coffee
here.
snob? I mean, I got you a Circle K coffee.
Yeah, I know
so you can't be a coffee snob, or else you just you didn't really have any other options.
This is desperate times. Right?
Yes, that's right. Are you like a barista? Do you have any sort of things?
I can be, but I recently switched to black coffee.
Okay.
I was trying to eliminate the dairy, and it's amazing how your taste buds evolve. I can't even think about putting cream in my coffee.
Now to go back,
It just disgusts me.
I know. I remember the double days when I started drinking coffee. I'd probably get sick to my stomach drinking one now.
Yeah, it's true.
What's the thing that you do to reset after a bad day?
I mean, if I'm being really honest, if it's a really bad day, there's probably going to be a gin and tonic involved.
Nice.
And luckily, I don't have a lot of bad days. So,
Yeah, it's good.
I'm not doing that very often. But I have a routine that I think, I have my coffee in the morning. I meditate every single day. And I think I've been doing that probably maybe for 10 or 15 years.
Really?
Yeah, maybe more.
I was like everyone thought it was cool and started doing it.
Yeah, I first discovered it in university, actually. I remember doing meditation. I used to get like nervous before exams, and somebody gave me like a cheesy cassette tape.
That's awesome. Incredible. How long do you meditate for?
It varies, but I would say on average, I like 20 minutes to half an hour.
Okay.
But I'll do like 45 minutes too. But
guided with anything or just?
I like guided.
Yeah.
But I will do it without guided too at this point, because I've been doing it for so long. But meditation is important for a few reasons. So let's say you have a really terrible day. For me, and I'll allow myself to convalesce about it for like a little bit. And I think you need to kind of like get it out of your system. And, I think the second biggest advice that I would give to founders is this. You have to choose your thoughts.
I love that.
And I once told somebody that your thoughts are like soldiers. You're in control of them, and you need to tell them where to go, because your thoughts will set you up for success or otherwise. So if you're lingering too much in a negative state, let's say, and you let that take over your thoughts, it's how you show up, right? And it's what you give to people. Like, I think it would be really difficult to be an uplifting leader if your thoughts are in the wrong place, right? So for me, a brutal day, it honestly begins with, I'm going to take a deep breath. I'm going to acknowledge this. I'm not going to take it personally. Let's say it's someone said something to me that I didn't agree with, and I'm going to choose a different thought. And it's very deliberate, and it's very intentional. And I'm going to remind myself of the things that bring me joy, and I'm going to be grateful for the life that I have, which has been amazing. But I think the most important lesson that has been transformative for me personally is the ability to choose my thoughts, because it affects how I show up for everybody. And the second thing is creative visualization, right? And there's some really great books on it, but I think sometimes founders think I'm crazy, especially if they're highly scientific, and, and I tell them like, what is your vision for this company? Like, where do you see this going? And if you don't have a clear vision of it, then it's just, and most founders probably do intuitively have a vision,
at some level, yeah.
But they're not necessarily sitting down and writing it out on a piece of paper. But I think having that vision and actualizing it through your actions and bringing positive thinking, and positive thinking doesn't always have to be like waking up in the morning and being like, I'm going to have a great
go-getter.
day,
Probably what my wife thinks I am most mornings.
Really? Oh,
yeah.
God, she's lucky.
Yeah,
then.
that's, well, she might argue some days, but.
But it's about self-doubt, right? It's about living fearlessly. It's about, acknowledging what people say and taking their advice, but it's transmuting it in a way, right? Like, okay, thank you for your advice, but this is how I'm going to feel about myself. So I think it's really, really important, especially in a startup, because, there's a lot of rejection. There's a lot of talking to VCs, and they're going to have their opinions, and it's really hard.
There's
like,
a
you
lot
need
more
a lot
no's
of
than
resilience.
yeses. Yeah.
Yeah, so I think that kind of thinking is imperative. I don't know of a single successful company or CEO that wouldn't be employing that, at least maybe not deliberately, but I would imagine intuitively as well.
If that doesn't come natural to someone, can that be a learned skill?
Yeah, absolutely. But I think you have to believe in it, right?
Yeah.
I think visualization is, for example, there was a lot of books written about positive affirmations, and people were, spewing out affirmations like a parakeet. I am smart, I am whatever. And there are meditations on positive affirmations too. But I think that's a good start if you've never done any meditating at all, because I think a lot of people have difficulty quieting their mind enough to get there. But I also think that it's about the energy that you bring, right? So if you have to match your energy with what you're saying. Like, if you don't believe in what you're saying is true, then it's kind of a waste of time, I think. I mean, it might put you to sleep, and it might be very relaxing at the end of a hard day, but I think it has to be really internalized and felt, right? Meditations, in my mind, it's an opportunity to emotionally connect with yourself.
Yeah.
Right? And it doesn't have to be, I'm just going to empty my mind and think about nothing. Sometimes meditating could be riding your bike, and you get into that rhythm.
Yeah, that flow state, some people say.
But you have to be very mindful of your thoughts and be the observer of it, right? So if you're constantly going back to thoughts that don't serve you very well, you're analyzing something someone said to you that was so immaterial that, 5 years from now, you're never, ever going to think about it. If you keep going back to that, then you have to sort of correct. You have to say, okay, I'm good. I'm going to go back to another thought. So a lot of people think meditation is not thinking anything, but for me, I can't meditate like that, right? It's impossible. I'm always thinking. Even when I'm sleeping, I think I'm thinking. So I think meditating for me is all about active thought, but it's choosing those thoughts.
I love what you said about the observer too, just sometimes realizing, hey, I'm working through a lot of things. I'm thinking about a lot, but just the awareness to say, hey, that's okay, and I can sort of watch this and it can pass.
Yeah. Do you meditate?
So as you're explaining this, I realized, I go back to pre-kids, and I'm almost, 3.5, 4 years of not consistently, but actually earlier this week, I sat on my living room floor on like the kids' mat for probably an hour just listening to some really cool meditative music, and it was the best part of my week, and it just helped reset, and a reminder for me that it's so important to quiet the mind.
To calm your mind.
Yeah, to quiet it, for sure.
You can get these like gadgets now. It's called Muse, and it's like a band.
I've seen those.
Yeah, and it's supposed to measure. We actually brought them in at a company that I worked in. We had a wellness program, and I sucked at that. So it actually measures, so if your mind is calm, then you can hear birds chirping. And then I think if your mind is not calm, then you can hear like waves crashing.
Wonder what I'd hear at this point.
And then it scores you or something like that.
That
like
is
how
so
many
cool.
times you heard the birds chirping.
Okay.
And I was so bad at it that I was like embarrassed to tell people like what my score was, because I never heard birds chirping. Like
No
my
way.
brain is always going. But like I said, I believe in active meditation, and I believe in using that opportunity to pick thoughts and images and visualize a life that's the one you want.
I believe it. I live it. It's something I
Yeah.
really admire that about people that can do that, and I think it's so important to, you know, in relationships, in work, in community, health, you know, to have that visualization point. And really, it's saying like, what do I want, and where
Yeah.
am I, and like, how do you bridge the gap between those two? And I got the Zen sense about you from the first time we met online.
Oh,
and
really?
yeah, you do. You have a very calming sense. So
Oh, thank
it's
you.
infectious. So
I feel that way about you too, actually. You do as well.
I love it. We're chill.
Yeah, I think so.
It's amazing. Victoria, I could just have you here for hours, and there's so many more things I wanted to talk about. So we'll do another episode, but
Great.
from the bottom of my heart, thank you so much for making the time to come down, for
Thank you.
tons of wisdom and great experiences shares. We'll include some of the links in the show to some of the great information to your company and how people can find you.
Sounds great. Thanks for having me. It was really fun.
It was my
I enjoyed
pleasure.
it.
Thank you.